welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. 1 in 4 adults suspect they have undiagnosed ADHD. A new national survey of 1,000 American adults commissioned by the Ohio State University, Wexner Medical Center and College of Medicine finds that 25% of adults now suspect they have undiagnosed ADHD. But what worries mental health experts is that only 13% of survey respondents have shared their suspicions with their doctor. That's raising concern about the consequences of self-diagnosis leading to incorrect treatment. Anxiety, depression, and ADHD, all these things can look a lot like, but the wrong treatment can make things worse instead of helping that person feel better and improving their functioning, said psychologist Justin Bartarian, PhD, clinical assistant professor in Ohio State Department of Psychiatry and Behavioral Health. An estimated 4.4% of people ages 18 to 44 have ADHD, and some people aren't diagnosed until they are older, Bartarian said. Study identifies sign tied to more severe cases of RSV. Respiratory syncytial virus is the leading cause of hospitalization in young children due to respiratory complications such as bronchiolitis and pneumonia. Yet little is understood about why some children develop only mild symptoms while others develop severe disease. To better understand what happens in these cases, clinician scientists from Brigham and Women's Hospital, a founding member of the Mass General Brigham Healthcare System, and Boston Children's Hospital analyzed samples from patients' airway and blood, finding distinct changes in children with severe cases of respiratory syncytial virus, including an increase in the number of natural killer cells in their airway. The descriptive study, which focuses on understanding the underpinnings of severe disease, may help to lay groundwork for identifying new targets for future treatments. Results are published in Science Translational Medicine. As a physician, I help to care for children who have the most severe symptoms, and as a researcher, I am driven to understand why they become so sick, said corresponding author Melody G. Duval, MD, PhD of the Division of Pulmonary and Critical Care Medicine at Brigham and Women's Hospital and the Division of Critical Care Medicine at Boston Children's Hospital. Better use of vaccines could reduce antibiotic use by 2.5 billion doses annually, says WHO. A new report by the World Health Organization finds that vaccines against 24 pathogens could reduce the number of antibiotics needed by 22% or 2.5 billion defined daily doses globally every year, supporting worldwide efforts to address antimicrobial resistance. While some of these vaccines are already available but underused, others would need to be developed and brought to the market as soon as possible. Antimicrobial resistance occurs when bacteria, viruses, fungi and parasites no longer respond to antimicrobial medicines, making people sicker and increasing the risk of illness, death and the spread of infections that are difficult to treat. Antimicrobial resistance is driven largely by the misuse and overuse of antimicrobials, yet at the same time many people around the world do not have access to essential antimicrobials. Each year nearly 5 million deaths are associated with antimicrobial resistance globally. Vaccines are an essential part of the response to reduce antimicrobial resistance as they prevent infections, reduce the use and overuse of antimicrobials, and slow the emergence and spread of drug-resistant pathogens. The new report expands on a WHO study published in BMJ Global Health last year. It estimates that vaccines already in use against pneumococcus pneumonia, Haemophilus influenza type B and typhoid could avert up to 106,000 of the deaths associated with antimicrobial resistance each year. An additional 543,000 deaths associated with antimicrobial resistance could be averted annually when new vaccines for tuberculosis and Klebsiella pneumoniae are developed and rolled out globally. While new TB vaccines are in clinical trials, one against Klebsiella pneumoniae is in early stage of development. First sign of Alzheimer's linked to quality of HDL in women. High level of HDL-C, known as the good cholesterol, have been shown to correlate with heightened risk for Alzheimer's disease. A new study published in the Journal of Clinical Endocrinology and Metabolism might explain why. Once women reach the menopause transition, it's a matter of the quality rather than the quantity of the total cholesterol carried by HDL particles circulating in a woman's bloodstream, and that quality declines over time, according to a research team led by the University of Pittsburgh School of Public Health epidemiologist. HDL particles vary in their size, composition, and level of functioning. The team measured these features in the blood of 503 women from the study of women's health across the nation, HDL ancillary study. The researchers found that over time, the number of larger HDL particles in the women's bodies increased, and these larger particles unfortunately did not function as well as their smaller counterparts. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.